Hello friends, how are you all? This is Sanjay Rai again with a very rocky information for all of you. So I got a lot of DMs about the public health insurance and the private health insurance. I have already made a video about it, but today I'm going to tell you some practical experience about it. Why it is very important for the students to take public health insurance as compared to the private health insurance, especially in this pandemic time. So today I'm going to meet one of my friend. He just got operated in Munich for his thyroid, and he just had operation, and it has been more than 7 days he was in hospital, and today there is a possibility that he will get discharged. So today I'm just going to meet him, and if he get discharged, we both can come back together to our dorm. And in this video he will be telling his part of experience. How was he treated when he went for the operation, how the bill was managed, how was the expenses managed, and all the things, which is very very important information for all of the students. So let's start. So I just came outside of my dorm. You can see at the back. You have also seen my student dorm in most of my videos. So I just saw the location on the map. It will take me around 1 hour to reach the hospital. So the people, you can see it's empty. So I have just reached here to the hospital. This is the hospital. The name of the hospital might be upside down. So it's the Martha Maria Kenken House. So this is the building, and I think he's on the 3rd floor. But yeah, there I see him. He's waving the hand, so I can now go inside. So just waiting at the reception because I cannot go up, and due to COVID restrictions, I cannot help him to come down. So when he comes down, like, so we can then go out from the hospital. So he's here. He just got discharged, and he's getting his bill cleared. He needed a sit. So finally we are back to our dorm, and we have Sajidul with us. He will share his part of experience with the public insurance. He is actually insured with the TK, and there are many public insurances in Germany, and you are free to take any of them. Me and Sajidul have taken the TK public insurance. So let's ask Sajidul what problem he had and how was his experience in German hospital. So I would like Sajidul to tell about.
Hello guys. I'm MD Shazidul Islam from Bangladesh. Actually, in Germany, two public health insurance is very popular. One is AUKA and one is TK. I chose TK when I came to Germany. And
So Sajidul, tell what problem were you facing in like what health issues you were facing.
Recently, I went to my house doctor for my regular checkup or monthly checkup, and he told me like that I have some problem in my thyroid, but I didn't feel any pain or other things when he told me about this. But for the further checkup, he sent me to the radiology for confirm it, and when I went there for testing it, they confirmed it. Yeah, your thyroid has some problem and there is some infection.
Okay, so then they told you to like you have to get an operation.
Actually, the radiology was not sure about this.
Okay.
They told us like that we are the radiologist and we just find out the problems, but the next what you have to do, then you can consult with the thyroid doctor. They will tell you what the next.
So first you went to the house out, which is your like a house doctor, okay, or a family doctor here.
Yeah.
Then he recommended you to go to a particular doctor to know about your specific health issue. So you were just using your TK card everywhere,
Yeah.
And you were not paying anything. I think.
Every place I just use my TK cards, and I didn't pay not even a single penny.
Okay. So that's a very best option especially for students, because when you are a student, you are always maybe facing some financial issues or related to the expenses. So this is the best thing about TK. You don't pay anything, and to whatever doctor you go, you just have your card, and you have to just swipe your card wherever you go.
They will just ask you, please give me your insurance card. You just give your card to they
And the
will
rest they take
confirm
care of
everything.
that.
Yeah.
Okay. All the things were very good. Tell about your experience. How were you treated?
Yeah.
How long was your operation?
Okay.
Hmm?
Actually, I don't know how long my operation was.
Okay.
But on that time I was senseless,
Hmm?
and maybe it was 2 hours, and they just find out the problems in your whole body if you have any precaution about this.
Okay. So they examine very
Yeah,
carefully.
very carefully.
Okay.
They tested me 3 times
Oh.
for one problem,
Huh?
and 3 days they called me for further confirmation hospital. The hospital name was Martha Maria.
Martha Maria.
Martha Maria. Yeah, it's very popular in München, or not only München, in the full Bavaria in Germany. Martha Maria is one of the best hospital for the thyroid operations or thyroid problems. Give me foods and all the supplements like that.
So for how many days you were in the hospital? Like after the operation, for how many days?
After operation, I stayed in the hospital 5 days.
Okay.
And
did you pay anything? Like, did you pay any charge every day, or
No.
everything was already sent to your TK insurance?
I didn't pay anything,
Oh, great.
and I don't know how much charge they will charge from the
Mhm.
TK, but everything will be paid by the health
By the
insurance
TK.
company.
Okay. So
And-
do you think like the charge for the operation, including all the hospital expenses, was more than 1,000 euros? I think
Okay,
it can be more than 1,000
The
euros.
facility which I got from the hospital, and their services, their doctors, and if you compare to the experience, and they are the professors from the medical colleges.
Okay.
So if you compare to our Asian countries, our South Asian countries, compared to this money value,
That is
then
much
I
better?
think it's much better.
Okay.
And the charge is at least 5,000 euro,
Okay. So-
because every day I admitted in bed. The bed fare I heard like that it is 490 euro for one day
one day, okay.
with
And
all services, because they.
so you were also getting the food every day. You were also
Food.
getting the diet chart,
Yeah.
and all the things.
Food, medicine, 2 to 3 times blood test,
Okay.
and other
And a proper care by the nurse.
yeah,
Okay.
proper cares by the nurse, and other different types of tests, suppose like that, because the operation was done in my throat, so they test the vocal cords every day, like that your vocal cord is okay or not. You see like that my voice is not louder,
Yeah.
because they told me like that you can't speak so loudly.
Now still you have to take rest for 2 to 3 weeks.
Yeah, 2 to 3 weeks, and 1 month later they already gave me the appointment.
Okay.
1 month later I have to visit there again for tests.
So regular test.
And they told me you have to stay 2 days in our hospital for testing.
So overall, he has a very good experience about it, and like he said, the total cost can be around 2,000, 3,000, or 4,000, but
In my views, I think it's more than 4,000.
More than 4,000,
Because
and he paid nothing. So
yeah, because if you compare to like that, in our Asian countries, when you call a specialist doctor for the operation, they charge like that. If you give me 1 lakh, then I will do this operation. Otherwise, I will not
also
participate in the
the
operation.
food
like
is also
that.
not included.
Yeah.
You get it, and the proper care also.
Proper care,
So
everything.
I think according to my point of view, it's very good for students.
Yeah.
But if you take we take any private insurance, like many of the students say that we will take a private insurance of 33 euros or something around that, or 40 euros
Maximum 40.
for maximum 40 euros. So I think that we have to pay the cost first. Like if you are admitted to hospital, you
Yeah.
get any major injury, like you get any injury in your bone or any major operation, so you have to first pay for that. Like he said, if the cost is like 5,000 euros and it's very immediate that you have to do that operation, then you need to pay 5,000 euros in that case.
Yeah.
And after that, they will send that cost to the insurance company,
companies.
and they will then reimburse it.
Yeah.
And
but
I don't know
maybe-
that how much
maybe
time that will
6
take.
months,
How much time? But for first, do you need the expense to get the operation? So according to me, I think the TK or the any type of public insurance in Germany, especially for students, is the best one. I think especially in the times of pandemic,
Yeah. Yeah.
you don't know what will happen or when you will get sick. So
And if you have some problem like that, suppose mental issue right now is in the pandemic situation, you think like that, I need to test my body. So but you can test your body every month without any cost if you have public health insurance.
oh, that's also very good. I think you got all the information about the uh, about the public health insurance in Germany and how it is beneficial for students. And I thank you all for watching this informative video. And if you think that my videos are creating some kind of information, very useful information for all of you, so please like, share, and subscribe to my channel. And I will be bringing a lot more information, not actually related to the applying system, because I know that there are a lot of bigger YouTubers who have already made videos on how to apply, where to apply, what type of courses. But still, I am open to your views. You can send me a DM and I will reply to all your questions. But mostly I focus on the student things or student categories, what type of difficulty they face, even about work. You can see in my description, I have made a lot of videos working in Amazon, working in Differendo, my full day routine, and a lot more of things. And here and wait for my next video. Bye.
Bye.